Okay, time just gone 28 minutes now to 11 o'clock. And as I did say earlier, that we have a guest in the studio, and I'm going to be introducing him to you. And he's got a lot of information to part, being Women's Month, and we'll see what our guest has to say and what information, valuable information, he has to pass on to us. So our guest today is Dr. Nick, and he is the founder of Aurelia Private Health. And today's discussion will be focused on preventative and longevity medicine, and with August being the month to celebrate the women in our lives, centered around women's health. Namaste, Doc, and welcome to Hindvani.
Namaste. Thank you so much for having me here today. It's such a pleasure.
It's a pleasure to have you as well. And I'm not sure if this is the first time you're on air or you have been on air before, but we're happy to have you here with us. Now, you have a very interesting topic to discuss with our listeners. Now, most of us believe that we should seek medical care when something goes wrong. What does it mean to begin health care before a diagnosis or before symptoms start?
I think that's such an important question in starting this discussion. So essentially, I think it's important to define some terms firstly, specifically prevention and longevity and how it relates to medicine as a whole. So we often ask ourselves, what is preventative medicine? And preventative medicine is not this false perception in which you will never get sick or ever be ill. It's basically identifying your risk at a specific point in time and then having various interventions, which is not necessarily led to medication, in order to optimize your risk in either helping you to prevent you from developing disease or to prevent the progression of a disease that you might already currently have. Now, that ties on specifically to longevity medicine, in which we don't only now want to increase our lifespan, which is, as we all know, the number of years we live. We also want to increase our health span. And what that basically means is it's a term that refers to increasing our quality of life, increasing our vitality, increasing our independence. We don't merely want to prolong the time that we're living if our last years are sadly lived in agony or in pain. So there are various interventions, and as I said before, it's not all pharmaceutical or medical based that we can do to increase our independence, our quality of life, and that's a lot on what we're going to touch on today.
Okay, often, what you were just speaking about now, it reminds us of the phrase that we often hear, that prevention is better than cure.
100%.
Okay, so how can a woman feel well, have normal blood results, and still have health risks developing quietly?
So the word that you use there, normal, what does normal actually mean? If we take laboratory results into consideration and the way in which they develop their ranges, it works on specific populations. So we as individuals don't fall into what we always taught in medical school is patients or individuals are not textbooks. We don't necessarily fall into specific laboratory ranges, and every individual is completely unique. Also bearing that in mind, a single laboratory result or a single blood test, for example, let's use it in context of a movie. A single blood test is a snapshot. It's just an image. We don't get the entire picture or understand anything with regards to that movie from a single test. That is why it is so important to track things over time and look at our health holistically. We can't make decisions as clinicians on a single symptom, on a single piece of evidence on an exam, on a single test, on a single scan. Everything has to be looked at holistically in order for us to understand the whole picture, in order for us to visualize the movie correctly. It's also important to note that there should never be panic or anxiety if there's a single abnormality. Of course, it could mean that something's wrong, but it could mean that something is also fine. So the most important takeaway is that nothing should be looked at in isolation. Everything should be looked at as a whole. And that's why trajectory and following up on certain results and scans, for example, are so important. Let's use an example of a laboratory range for any blood test. If we state that the normal range is between 5 and 10, and you just had your bloods done and your result is 5, perfect. You think that everything is completely normal, which again, most likely it is. However, if previously a few months ago that result sat at 10, what is the reason now for such a dramatic decrease in that specific result? And that is why it's so important to not look at anything in isolation. Everything should be looked at as a whole, holistically, with regards to your health.
That's so interesting. I hope our listeners are really paying attention and making notes, so that they can contact you at the end of this discussion and get more information if they want to, because what you are saying is just so interesting. Some of us never heard of some things that you are talking about, and I'm sure our listeners are finding it interesting as well. So women's health is often just focused on reproductive health. Which silent risks should we also look at? Which silent risks?
100%.
I'm sure there are many risks. So,
of course.
Yes.
100%. So I don't want to take anything away from reproductive health. It deserves the importance that it has because of essentially how big it is. I mean, it has its own division in medicine. Obstetrics and obstetricians are specifically there for reproductive health. However, it's also important to be aware that there are other diseases facing women today. And it's important to note, and I like the word that you use with regards to silent. If we just take the three main diseases that society as a whole globally face today, let's look at heart disease or high blood pressure, which is hypertension. The second one is metabolic dysfunction, which is diabetes. And the third one, which is cancer. So all these three, I mean, it's ubiquitous. It's completely common in society today. We all know someone that suffers from at least one of these. All these three can occur for years, if not decades, before symptoms ever occur. So your body can be building up slowly. However, you might be feeling completely well. And if you take a statistic that the World Health Organization has published in 2024, so they estimated that 33% of individuals aged 30 to 79, so majority of adults, had high blood pressure, which is hypertension. However, only 50% of them were actually aware of it. Now, that is actually quite a scary thing to think about because 1 in 3 people basically had high blood pressure, but only 1 in 2 of those even knew about it, which means there were no interventions, there were no targets to specifically treat that. And again, I'm going to emphasize, treatment is not medication. Medication is the last thing in which we should incorporate. It always starts with lifestyle. So lifestyle interventions come first and then treatment occurs. And I think it's so important to bear that in mind because there are something we know as modifiable and non-modifiable risk factors in each person's life. Modifiable means things that we have control over, things that we have a lot of influence on, our nutrition, our exercise plans, smoking and drinking, for example, and the non-modifiable risk factors as to things we can't change, our genetics, our family history. However, modifiable risk factors play such an important role in preventing disease and preventing the progression of disease. And we're going to touch on this later on with regards to how much of control we as individuals actually have in preventing disease. And again, prevention doesn't start when illness develops. It doesn't start when you have symptoms or when you feel as if something's wrong. It starts right now before anything happens to prevent the illness, the symptoms from actually occurring in the first place.
Doctor, there's so much of information that we're getting from you, but tell us, how should we approach breast and cervical cancer prevention without creating fear or unnecessary testing?
100%. So I like the term unnecessary testing. A test, where it be a blood test or a scan, should only be done if the result is actionable. There's no point in obviously having the fear or anxiety and now spending so much money on various tests to be done if the result of that is not directly actionable. If I do a test and the result comes up as normal, or if it's high or if it's low, what am I going to do with that result? If there is no actionable item with regards to that specific result, for one, it shouldn't be done because it's just a number. And with regards to breast and cervical cancer, again, so common in society today. Again, speaking on a statistic, the World Health Organization estimated recently that 2.4 million women globally suffer from breast cancer. And that's a very alarming figure to think about. We all know someone, sadly, that has breast cancer, but it's important to note South Africa specifically has such amazing screening interventions to prevent the onset of breast cancer. We can catch it early. And it's so important to catch breast cancer early because that is when treatment is most effective. There's statistics and various studies which have been done which show that, unfortunately, and it's sad to say, the survival rate of breast cancer when it has spread, so in the late stages, is only between 30 and 40% when treatment's initiated. However, in the early stages, if you take in proper screening methods and you catch it at the early stages before it has spread, the survival rate is above 90% once treatment has started. And I think that's so important to know because with regards to screening, it's specific for a specific woman. It takes into account your age, it takes into account your previous risk factors, whether you had previous scans which were abnormal. So there's no fear, there's no panic, there's no anxiety which needs to occur. A simple discussion with your clinician as to, am I due for a mammography? Am I due for a breast ultrasound? What interventions or what are the next steps from here? When should I have it done? It's so important to note. And something that is also so important to know is that prevention does not start with a doctor and it does not start at a hospital. Specifically for breast cancer, it starts with a woman at home. So there's no one that knows a woman's body better than herself. Self-breast exams have become so important in actually preventing the occurrence of breast cancer. At home, if a woman can do self-breast exams in which if she has a lump, if she has progression of a lump that has previously occurred, if she has tenderness, if she has discharge or specific changes, she is the one who can pick that up first and then have a discussion with her clinician about that, and then they can take the next steps forward. So again, medicine and prevention is not a luxury, it's not expensive, it is not supposed to be that. It starts at home with you and then a simple discussion with your clinician and to take the next steps forward in screening methods such as mammography, breast ultrasounds, for example. Then touching on cervical cancer, again, so important to note the screening methods for that. South Africa has such great initiatives with regards to screening of cervical cancer. We initiate vaccinations for HPV, which is the human papilloma virus, which is a major cause of cervical cancer. That starts in schools from children who are aged from 9 years old. So ensure that you are fully vaccinated for HPV because it's a main cause of cancer. And again, screening methods are specific to each woman with regards to their age, with regards to their risk factors, family history, for example, with regards to any previous results which were abnormal, if they have HIV or non-HIV. So it's specific to them, each individual woman. And again, no fear, no anxiety, no panic, a simple discussion with your clinician to, am I due for a pap smear? Am I due for a screen? What are the next steps in follow-up? And then you take it from there. I think the best way never to create fear or anxiety or panic is to just be aware of what the next steps are. And that's so important to know.
Doctor, the next question that I'm going to ask you, I am sure most of our listeners can identify with this and they'll be just waiting for your answer. Heavy periods and tiredness, are they related?
Yes and no. So heavy periods, for one, is a very subjective term. What is a heavy period? If you have menstruation as a young woman who just starts menstruating now, they are not really aware of what normal is. So it is so important to have a discussion with the young woman in our lives to state that these are the changes happening to your body. Let us take control of it. Let us find out what's normal for you. And then again, as a woman ages, no one knows a woman's body better than herself. So it's so important to know what is normal for you. If you have a sudden increase in the amount that you are menstruating, if you are menstruating for longer, it's so important to, again, have a discussion. It doesn't have to be discussed with your clinician or with a healthcare professional. It's so important to have a discussion with your friends, with your family, and then identify, is this normal? Is what I'm going through normal, or does it need to be taken further? And then we can investigate as to what's going on. However, heavy periods is the loss of blood. When we lose blood, we lose iron, and iron deficiency is such an important cause of anemia. Anemia presents in various ways, the most common one being tiredness, fatigue, lethargy, your heart beating fast, which is palpitations, headaches, dizziness, for example. So if those symptoms do occur, it's not to say directly, oh, I'm anemic, I now need to go to the pharmacy and buy iron and I'm going to take iron. Iron, yes, is an over-the-counter supplement. However, something that I noticed in my patients is they are very good in knowing what they have majority of the time. However, self-diagnosing and self-treatment forms a bit of an overlap that I would always recommend discussing with your clinician. Our best friends nowadays are ChatGPT. However, ChatGPT unfortunately can't see your health holistically. They can't tie up your symptoms, your examination, your testing if necessary, what is specific to you, and then give you appropriate intervention. So, if you are truly iron deficient from having heavy periods, which obviously needs to be investigated as to why you are having heavy periods, it's important to note if you are truly iron deficient and then supplement with iron from there. Because again, iron is considered a supplement, but it has its own side effects, it has its own interactions. It shouldn't just be taken blindly for a blind amount of time. Supplements are there for a reason and it's specifically indicated for a specific cause. So it's not that it's going to be the quick fix and everything is going to be fine. Find out truly if you are iron deficient, and of course, it has a purpose from there. So, is fatigue and heavy periods related? Of course, it is. However, it could not be. You could be anemic for a variety of other reasons. Consistency over perfection. Let us look at ourselves individually and see what works for us, not what works for the general population. As I said before, patients are individuals, women are not textbooks. We have to give them interventions that work specifically for them. So, what I'm going to touch on are the 5 foundational aspects for prevention or health as a whole, and each person listening today can implement this starting from today. So, the first one is nutrition. And I specifically didn't say the word diet because diet has the stigma associated with it in that it's short lived and I need results right now and then I'm going to stop it. So, nutrition is something that you're not going to do now for 5 weeks. You're going to be doing it for 5 years, for 50 years. It's a plan that works for you. And again, it's nothing about perfection. What I like to tell everyone is that let's have nutrition with 80-20%. And what that means is 80% is clean foods, is single ingredient foods. And the reason I say single ingredient is because there are so many artificial colorants, flavorants, preservatives, ingredients in our foods that we can't even pronounce. So single ingredient foods have nothing added to it and they are generally considered healthy. Eggs, fish, meat, vegetables, carrots, apples, for example, there's nothing added to that. So let us incorporate more single ingredients foods. As women age, they have muscle breakdown, which is known as catabolism, which is the breakdown of muscle tissue. So it's so important to prevent that by increasing high quality sources of protein. And there are so many other aspects that we can touch on with regards to nutrition, but find a plan that works for you that you can be consistent with and improve it from there. People are so educated now on what is good for them and what is not good for them. So if we have a general 80% of healthy foods that we incorporate into our daily lives and 20% of foods that are not so healthy, but it keeps us on the right track. We psychologically well by eating these because it's something that we love, then it's something that we can be consistent with. The second foundational aspect that I want to talk about is let's get moving. Now, again, the reason I didn't say exercise is because people are at very different stages of their life. There's various different exercise bodies that have come together and now concluded that 150 minutes of moderate intensity training weekly and 3 strength sessions a week is what is recommended for every person. However, I can't tell someone now that has severe heart disease, for example, that you must now do 150 minutes of moderate intensity training and 3 strength sessions a week. It's not fair for me to say that because as a clinician, they are going to put a lot of strain on their heart. So that's why advice is not for the general population, it's specific to you. So let's get moving. What that means is let's move more than what we're moving now. Being sedentary or not moving is one of the largest causes for developing disease. So let's move more. Let's increase our step count. If we're already at the gym, let's increase the intensity of our training. And I think that's so important to just be aware of. And let's get moving can be in any shape or form, but just move more than what we're doing now. As I mentioned before, women go through catabolism, which is the breakdown of tissue, and that can be combated by resistance training, which is weight training in the gym, for example. But again, women are at various different stages of their life. Do what works for you, not what works for anyone else. Start training slowly and expand on it from there. The third aspect that we're going to talk on now is sleep and mental health. So everyone is fixated on this 8 hours of sleep. However, research now shows that it's more about the quality of sleep and going to sleep and waking up at the same time. So we shouldn't only set an alarm for the time that we want to wake up. We should actually set an alarm for the time that we want to go to bed and prevent any distractions from there. So specifically with regards to increasing our quality of sleep, let us decrease the total amount of caffeine that we consume in the day. Again, that's specific to you. Large studies have concluded that 400 milligrams of caffeine, which is two large lattes, for example, are recommended. However, if you have a heart rhythm abnormality, that is definitely too much for you, and that is why advice is not for the general population. It should be personalized to you. So cut down on caffeine and let's not consume too much caffeine too late in the day. Ideally, nothing after 1 or 2 p.m. And it's important to note that women in general love tea. It's a generalization, however they do, but there is tea and caffeine. So just bear that, caffeine in tea. So let's just bear that in mind. The increasing quality of sleep is also to reduce screen exposure or exposure to TV or cell phones too late at night. Having a dark and cool room that we're sleeping in, not having any distractions or eating around the time you're going to sleep, and that is all to increase the quality of our sleep. The fourth foundational aspect we're going to talk about is smoking and alcohol use. So, if you don't smoke any nicotine or tar containing products, including vapes, and don't consume alcohol, that is amazing. Let us keep it that way. However, if we do, it's again not practical for me as a clinician to tell someone who smokes a pack of cigarettes a day that this is bad for you, you need to stop tomorrow. It's not something that can be sustained. So, let us cut down slowly and improve on that over time. The last aspect that I want to talk about that everyone can incorporate today is let's know our numbers. So I'm not going to recommend any blood tests which can be done because that is specific to an individual, to a woman, and specific to something they can act on. However, if we know our blood pressure, if we know our fasting glucose, if we know our weight, our waist circumference, those are all very cost effective, very easy methods that each person can do today that forms such a strong baseline and it has such a key indicator into our health. And then we can track it over time and improve it from there. Because again, health is not snapshots. We want to track all these metrics so that we can view our health holistically over time.
Doctor, there's so much more that I want to ask you and so much information that we need to get from you, but it's almost time for the news.
Of course.
And we can continue after the news if you wish. Otherwise, you can give your details now to our listeners, and I'm sure they'll be happy to contact you. Can we continue after the news?
Of course,
We will.
we can.
Okay, so the news girls will be here in a bit. But before the news, before they come in, medicine often comes with expensive tests and scans, right? So should we be doing as many of these as possible to keep us healthy?
So the answer is definitely not. As I stated before, medicine is not a luxury. Preventative medicine is not a luxury and shouldn't be considered as that. There are various things that we touched on today which are completely free, and you don't need a hospital or a doctor to do. So it all starts with you. It all starts with something that is actionable, that works for you, and expanded upon from there. And as I stated before, tests can be very expensive, scanning can be very expensive. However, if nothing is actionable, if there is no outcome from a specific test that is done or a specific scan that is done, it shouldn't necessarily be done, in my opinion. So everything has to be personalized and go according to a specific woman and then expanded upon from there.
So, welcome to the third and final hour of our program. And the interesting thing is, the good news is that we still have our guest here. And just in case you missed the beginning, our guest today is Dr. Nick, and he is the founder of Aurelia Private Health. And he's been giving us some very, very interesting information from the time we started our interview at 10:30, and we have so much more to find out from doctor and to ask him things that goes on in our day-to-day lives, and I'm sure that you have caught some of them, but if you didn't, if you just joined us, then welcome to you, and we're going to continue to interrogate our doctor here with more questions that's going to be helping us to live our day-to-day life. Now, doctor, what is an example of good preventative health assessment for a woman, and what should she do first?
So I'm going to emphasize again, specifically for any woman, health doesn't start with a doctor and it doesn't start at a hospital. It starts with you at home. Again, I'm going to say the same thing. A woman knows her body best. So analyzing her own symptoms, discussing it with her friends, discussing it with her family. You know what? Is this normal? Is it not normal? And then expanding upon that with self exams. We mentioned the self breast exams. It is so important for prevention as a whole. And then all those findings that you have, relaying it to your clinician, having an in depth discussion to truly ascertain, is this normal? Is this abnormal? Do I require any further screenings, any further testing, and so on and so forth? But what's, I feel, a preventative health assessment should look like from a clinician's point of view, and again, this is just my opinion of how it should be, is it starts off with you with the self-exams, and then it starts off with me wanting to identify your history. And history is very specific with regards to a woman, in which we want to know all about menstruation. We want to know all about the reproductive cycle, all about a pregnancy history, diseases that she might have, a family history of diseases. We want to know about medications. We want to know about changes of medications, supplements. So try and be as detailed as possible. And again, modifiable risk factors, which are things that you have so much control over, plays such an important part of that exam. So your specific nutrition, your specific exercise regime, your smoking and alcohol status, your sleep. Let us find out all about that. And then from there, we move on to a targeted examination in which we'll confirm possible findings that you might have found on your exam. Following on which there's testing. And again, testing is not throwing 1,000 tests at once. It starts off with very simple measures. Your vital signs, your blood pressure, your resting heart rate, your fasting glucose, and then expanding upon from there with tests that are specific to you and going to be actioned upon. And so on and so forth. You can have the baseline and then follow it up, because health is not a snapshot, it's a trajectory, and we should never look at health in isolation with a specific symptom, with a specific test. We should look at it as a whole in order to see the full picture.
Should every woman take supplements? This is very important.
It's very important, and there's a very direct answer. No, definitely not.
No?
So
Okay.
a supplement is very specific to you. In a woman who is in their teenage years compared to a woman who's now in their reproductive years, or maybe they might be pregnant, again to a woman who might be in their perimenopausal or menopausal stages. They all have very different lives, they all have very different risks, very different priorities, and very different requirements. So supplements are called supplements for a reason, because they cannot outdo a bad nutrition plan, they cannot outdo a bad diet, they cannot outdo years of smoking and drinking, poor sleep. They are only there once all that is optimized. And of course they play a role, that's why they're there. If you have a specific deficiency, for example, if we just take being vegan or vegetarian, they could be deficient in B12 or folate because they're not getting enough of that in their diet. So of course, supplementation with that will play a huge role for them. Women who, as I explained before, are iron deficient when they have heavy menstruation and they've proven to be iron deficient, iron will play such a crucial role for them as well. But again, supplements are specific to an individual, and it's important to bear in mind that even though supplements are easy to get, they're over the counter, they have their own side effects, they have their own medical interactions as well. So it needs to be very properly studied upon, that what works for someone else might not necessarily work for you. And again, it's so important to be educated and proactive about our health in order to really be certain as to what works for us and what doesn't work for us.
Should women lift weights?
100%.
They
Women
should?
should definitely
Okay.
lift weights. So lifting weights is a very broad aspect, because as I mentioned before, as women age, they have the breakdown of muscle tissue, which is called catabolism. So in order to prevent that from happening, we can combat that with resistance training. And again, It doesn't conventionally mean now getting a gym membership and hiring a trainer and lifting weights 5 days a week. That's most definitely not what it means, because I know a lot of women who will will never do that. So it starts off with where you are currently. If you've never been to the gym in your life, it's now very difficult to take a gym membership and go and start lifting weights. So let's expand upon what you are. Simple body weight exercises of what works for you, something you enjoy, something you can do with a friend so that you can both be consistent with it, and then expand upon from there. I'm sure we all know of a woman in our lives who sadly, as they age, as they were in their older years, they had a very simple fall and they might have broken a hip, they might have broken a bone. So, due to these hormonal changes as we age as well, especially in the menopausal regions, we have decreased bone mineral density. So, women's bones become weaker. So, it's so important as well to combat that with the training, to strengthen our tendons, to strengthen our joints, so that we have muscle around those areas. So, I mean, a simple fall is not going to result in a broken hip. And that is why resistance training of what works for you and expanded upon is so important.
Doctor, we have some WhatsApp messages here, right? I'm just going to read them out
Of
quickly.
course.
Namaste Geeta Di and Doctor. Thank you so much for an informative program. There is so much that we take for granted and overlook so many things concerning our body. Women always worry about the kids and hubby that we forget our own body. Once again, thank you. That comes from Julie. Thank you, Julie. And we'll leave doctor's details with you. You can contact him if you want. There's another one here. I'm 34 from Santon. I'm Sarisha. What are good vitamins for women to take for gut overall energy and support system?
So that is such an important question. With regards to, so I'm going to emphasize again, what works for someone else, most likely, and I'm going to say most of the time, is not going to work for you. So let's talk about gut. Gut health is so important, and there's so much talk about it nowadays because of the role that it plays in our body as a whole. So people often have a lot of misconceptions about this and are often unaware of how important our gut health and our gut microbiome actually is. So people often say, I have this gut feeling, or, my gut tells me not to do this or to do this. And that's true because your gut actually has a brain that communicates directly with the brain in your head. So if we have, and studies show, and there's a lot of evidence that shows, if we have very good flora in our gut, it affects our entire body. It affects our metabolism. It affects our heart. It affects multiple systems in our body because nothing works in isolation. They all work together. So with regards to supplements specifically, to answer your question, there's no one supplement. I wish I could sit here and say if you eat 8 almonds a day, you're going to be cured of disease. Unfortunately, there's none of that. So what works for you, but it all starts with diet. So again, maybe I misused the word. It all starts with nutrition. So fermented foods, yogurt, which is very common, very easily found, has a lot of pre and probiotics, which are very good in regulating gut flora. There's not really a supplement. Prebiotics and probiotics are very controversial into that they have a generic amount of bacteria, which maybe you're deficient in or maybe you're not deficient in. So you might be taking it for nothing, or you might already have the bacteria in which these probiotics or prebiotics sort of have in them. So again, it's what works for you, but something that is easy, something that everyone can incorporate, and something that I really highly recommend is fermented foods. Kimchi, sauerkraut, pickled ginger, but the easiest one is yogurt. If we can incorporate more yogurt, and I'm not saying now you must eat yogurt 3 times every single day, just increase it a little bit in your diet because it's proven to have a lot of benefits with regards to gut flora.
Okay, there's a lot of questions coming up, Doctor, and I think it's best they contact you.
Of course,
no
problem.
And okay, please give us some insight into weight loss for girls. Okay, so all these questions you can put through to doctor when you're going to contact him, and I'm sure he'll be able to help you out. I just wanted to ask, I recently had a blood test done and found out I am allergic to wheat, fish, soya, egg whites, peanuts, steak and fish. So what vitamin pills can I take? I feel so tired because I barely eat, and these days cause hard to find anything to eat.
Yeah, okay, that is unfortunately very sad because it's quite a significant amount of your diet that's now cut out.
Yes.
But again, I'm going to emphasize there's no single pill, there's no single supplement that can outdo what a good nutrition plan has. And unfortunately, I mean, if you are allergic to all of these, there are various other methods. And because the research has gone so far in now having very good vegetarian sources, very good gluten-free sources, very good ketogenic sources, there's something for everyone. You just need to find what works for you. But in terms of a one quick fix for unfortunately being fatigued, it's most likely due to nutritional deficiencies because you are deficient in so many foods. But unfortunately, you can't eat it, and I'm sorry to say that. But it all starts with a specific nutritional deficiency which is specific to you. It's not really right for me to sit here and say, you know what, that sounds like you might be iron deficient. That sounds like you might be B12 or folate deficient. That might very well be, and then that requires supplementation, but it has to be confirmed with specific testing. But something that I would recommend very highly is assess your B12, so specifically with regards to diet and nutritional deficiencies, which can present with the symptoms of tiredness, fatigue that you mentioned. Assess B12, assess folate, assess vitamin D, and assess iron, and only supplement if you are truly deficient in these.
So our guest today, very interesting guest, was Dr. Nick, and he's the founder of the Aurelia Private Health. And Doctor, your details, please.
Of course, so you can engage with me on socials. We are on Instagram, we are on TikTok, we are on YouTube. That's all at Aurelia Private Health. The company is on LinkedIn as well at Aurelia Private Health. Please send in all questions. We love to engage with everyone. We love to provide multiple education sources and just be as of much benefit as possible to everyone listening. So thank you so much for your time. It was such a pleasure to be here today and looking forward to engage with everyone on the sources that we just mentioned. Thank you so much.
Thank you, Doctor. There's more questions coming up, but I'm sure if our listeners contact you, you will be able to help them out for whatever problems they have.
Of course. Thank
and
you
once
so much.
again, thank you for gracing our studio with all your important information. And we hope to see you again sometime. So all the best to you.
Thank you so much.